Okay.
John King was in that spurt.
Well, I wish I'd known when John said he would come on the commission that he couldn't come to meetings on Thursday morning. We forgot to clear that. Every time now I've talked to anybody new, I'm like, can you come on Thursday? Well, now it's Tuesdays. Yeah, I was thinking about that the other day. I was thinking he never got a call while I'm sure he got calls like probably right after. All right. So, yeah, this is a new thing. Yeah, this is a new agenda. So that's how we're going to start. So I'm Barbara Ackenbaum and I chair the commission and I welcome everybody here. We're very fortunate to have our new members, Tracy Hamill and Maria Magliacana. And Amy's going to bring her staff too, and they're going to be talking a little bit. So we have a new agenda because we also added a substantive item, which is just talking about a town initiative, and John's going to take it. But we need to approve this new agenda before we can start the meeting. So can I have a motion to approve? Hi, come on in.
Motion to approve the agenda. Second.
All in favor? Okay, come on in, you guys. Come in. There's chairs for you here.
Thanks again to Jennifer. It's done such a great job.
Yes.
Yes.
Yeah.
Thanks.
Well, let's approve the minutes as well. Yeah.
Okay, oh, good.
So we'll also approve the minutes from our December meeting. All in favor? We're good? Okay.
Second.
All right. So welcome, everybody. It's nice to have you all here. Amy suggested that maybe her people would want to come and she'd introduce them. And then I took it a step further and said maybe they could talk a little bit about what they do. So, did you know that? So we're happy to have you. And we have our new commissioners, Tracy and Maria. So I thought we'd just go around the room and introduce ourselves. And maybe the commissioners will go first. And then Amy, you can just jump into your report and whatever you want to do from there. Okay. So I'm just going to tell you about myself. I've been in New Canaan for 23 years. I have 3 daughters and they all live in Brooklyn. They're married, they live in Brooklyn, which sounds great, except when you try and get to Brooklyn. And you have to pay for things. But anyway, I'm very fortunate because they're nearby. And I had a career in marketing and communications. And then I was kind of a professional volunteer for a long time. And then my last job was as executive director at Staying Put in New Canaan. Peter?
Longtime New Canaan resident, my wife and 2 daughters, 18 and 20. And I been a commissioner for 3 years now, and I run a private equity firm focused on education and youth development. So there's some of what we do, and proud to be part of this group.
I'm John Knight. I've been in town since 2007. I was a longtime board member on the Community Foundation and helped oversee their annual grant process, which is where I got to know a lot of the nonprofit network in Lower Fairfield County. And I'm also volunteer EMT with the Ambulance Corps.
Russ Barksdale, President CEO of Waveney Life Care Network. Been in healthcare for about 40 years now. So 5 sons, 2 grandsons. My foray into New Canaan is my mother-in-law was actually raised in New Canaan. I won't say how many years ago that was, but in any event, New Canaan's a beautiful town and great to be part of this committee and everything that you guys do. Very proud.
My name is.
Oh wait, let's okay. Well, yeah, because we're gonna.
And then you just turn the mic on.
Tracy, you want to?
So hi, I'm Tracy Hamill. I'm one of the new commissioners, and I've been in town since '91. My husband grew up here, started when he was 8, and I had a previous career in finance in New York, but I then retired early, and I have been on nonprofit boards in town since then. I was on Waveney for quite a long while, and now I'm one of the co-directors of CERT, and I'm very happy to be involved.
Great.
Hi, I'm Maria Magliacano. This is my first meeting as well. Hi, ladies. Grew up in Chicago, but I've been in New Canaan since 2004, I think. So I have 4 girls. I'm a nurse and a pediatric nurse practitioner. I work a little bit in the schools as a substitute nurse, and at the preschool as a nurse consultant. And I'm currently president of National Charity League, so I work with a lot of the nonprofits. And I also sit on the Nature Center board. So
It's always the busy people.
Hi, I'm Jen Laddick, and I've been on the commission for a couple of years now. And in my past life, I worked with homeless and runaway youth in San Francisco, mostly around education and employment, but there was a lot of social service involved in that as well. But since moving to New Canaan in 2006, Gosh, I know. I've mostly just volunteered at nonprofits and in the schools around the area.
Right. Okay. And I should mention that Raquel Harrison has moved off the commission, and you all probably know that she was invited to be elected to serve and fill out one of the terms on the Board of Education. And she was great. She's only here for 2 years, but she made a lot of great contributions, great medical professional, and also very tuned into the needs of the families in our town. So while we're losing her, and I'm sad for that, I think it's a really good thing for the community that she's going to have that impact on a broader level. So just wanted to say thank you to Raquel. I'm sure she's tuning in. Not so. All right. So Amy, let's turn it over to you.
All right, so Amy Lahaney, I'm the Director of Health for the town of New Canaan. For those who are new, I've been here for just about 7 months now. And so I came from the town of Monroe Health Department, where I was the director for 2.5 years. I had a brief 7-month stay in Bridgeport, where I was the Deputy Director of Health and Social Services. But I was 12 years in Fairfield as a sanitarian and started in Stamford way before that. So I've been in local public health for over 20 years now. Love New Canaan, super excited to be here. Great town, love the downtown vibe. Similar to Monroe, so a lot of it had been the same for me without any changes. And so today I brought my staff so you all can meet them, though I think you probably know them all more than you know me. And so if you
guys can take your coats off.
if you want to just introduce
Chilly.
yourself and kind of tell a little bit about what you do.
I'm Shannon Valerie. I've been with the health department for New Canaan for around 6 years now. 5 years, sorry, 5 years, no, 6 years.
Yeah, almost 2026.
Before that, my past career, I was still in New Canaan. I was with planning and zoning. I got pulled in, as you guys know, during the pandemic to do public health stuff. I loved it ever since. My counterpart, who's not here right now, is Kelsey McCarthy. She will come next meeting to meet you guys. We work on public health programs together. We actually have one coming up at the Lapham Center for seniors on boosting their immune system during the winter months. So we're anywhere really from some mental health stuff like QPR, mental health first aid training, but the focus is on disease prevention at the end of the day. So that's the majority and chunk of our programs and presentations. We also do environmental health, me and Kelsey. So that's septic, well, lead cases, and food. I think I covered.
You're all done? Yeah. I am Deborah Katz. I came to New Canaan, I think, I don't live here, but I came here because my daughter danced with Need starting in 1999. And then I became a big part of that school, plus the nonprofit, plus the professional company and all of that. And I started working for the town, actually, in the assessor's department part-time in 2007. And then I've been working for the health department since, as their administrative assistant since 2014. Great.
Hi, I'm Ellen Samai. I've been with the health department since January of 2022. I came on board providing COVID-19 help with our vaccination clinics and testing clinics. And then I have stayed on part-time. I administer vaccines for children, flu shots, back to school, vaccines. I offer health screenings for Lapham Community Center members, schoolhouse apartment members, and most recently on Wednesdays, we're doing employee health screenings over at Vine. And I test blood sugar, A1C, blood pressure, and answer any Ask the Nurse questions. And prevention, as Shannon mentioned, prevention is most important in public health, knowing your numbers, catching something before it becomes more progressive. And I can say I have caught a number of hypertensive people, pre-diabetic and diabetic people.
And you participate in some of the programs that Shannon offers,
Yes.
right? Yeah.
Yeah.
Yeah, which is great. They're a great team. I learned about organic food.
Yes, we do many health talks all health topics. And they have gone over very well with our residents. And we also receive input from our residents. We ask them, is there any topic you'd like us to cover next time? And they always have great ideas. So we have very good attendance with that.
Okay, if we ask you a couple questions. Do you have, what kind of attendance do you get at the weekly screenings from the staff?
The employee health
Employee, yeah.
is it's been low, but we just initiated the program.
Okay.
We have like
So
a select number of, there was a general screening at a health fair, and if you had concerning numbers, then you were to
Oh, okay.
right.
hold. So not, if you were generally healthy, you don't have to come in as
Right.
often. If you had a number outside of a range, it was recommended you
Right.
receive
And
follow
those
up with the
people,
public health
right,
nurse.
and they did come back. So for our
Yeah.
health screening, I think we had about 20
Oh, wow.
employees that came.
Yeah.
That's great.
I'm sure that's.
Which was really nice. It was really nice to offer that. I usually at that health fair administer the flu vaccines. This year was different.
Mhm.
And they received a flu shot from an outside company.
Oh.
So I was able to do the
Talk to
health
them more.
screening.
Yeah, that's great.
So about 20, I
Yeah.
would say for that.
And
So
Shannon, oh, sorry, go ahead.
Sorry, go ahead. I'm sorry.
I was just gonna say, you just got trained as a mental health first aid instructor, is that
Yeah.
right?
Yes, it was very long. But it kind of piggybacks off of QPR. QPR's focus on suicide prevention. Mental health first aid training is to recognize any mental health crisis, so even substance abuse disorders. And when I do QPR, I will often try to emphasize that it's not just suicide, it's any mental health as you took.
I was
took it.
going to
Yeah.
jump in and say, if anyone has not done the QPR training with Shannon, I highly recommend it. She is amazing. And it's also a ton of really good info. Even some of it is new, some of it isn't new, but it gets you thinking about it again and feeling like, fresh in your mind. So
And
anyway,
I
highly
just-
recommend it. You're amazing. You do a
And I
great
just
job.
Say too, that you give us language that's really practical. It's not just,
Yeah.
it's really more.
What it would look
benign,
like in
I
an
wanna say.
everyday.
Yeah, how you can just have a conversation.
Yeah.
Piggyback on that, I was in your very first one that you did at the library.
Oh,
It was
my
amazing.
goodness.
And so we've been encouraging
Yeah.
certain
Oh,
members
okay.
to go to these when
Okay.
when we see this.
Yes.
The employee one.
The employee, yeah, we did employee ones as well. The mental
That's
health
great.
first aid training is a bit longer. It's an 8-hour training. So it's going to be harder to have people designate that amount of time for this. I believe Marcy.
Yeah, Marcy's not here.
Oh.
Her daughter had her wisdom teeth.
Oh,
out, so she's
okay.
home
So
monitoring the med.
Marcy's going to be starting off with staff first,
Mhm.
emergency response staff.
Mhm.
And then from there, we're going to kind of like develop a plan of
Right,
how
'cause
to.
Yeah, I talked to her
Yeah.
yesterday and she said, in February, there's just only space for 15, right? Because you're doing it.
Yeah,
in
you
May,
have to I keep QPR small. I try to keep it around 12 and just try to do them more frequently just because that's how you get people to share. I did a bigger one and it just didn't have the same effect.
Mhm.
So I just decided to do it more frequently with less people.
That's great.
Yeah.
But she is going to do you're going to do another one in March
Yes.
for more people. And
Yeah.
Tracy had asked whether people from CERT could come.
Right, and she hadn't gotten back to me, so I just assumed that had filled up this time.
Well,
in
this time, I don't know that it's filled
Yeah.
up, but probably, hopefully it will. 'cause
This time's filled up. I think next time hasn't opened yet, so it will probably
At
be
some point, I'd
for
love
that.
to get cert.
Yeah, she said Marcy said she'd get you the information for the
Yeah.
March session, because that's, I guess, great 2 sessions.
Yeah, great. Yeah, I think she's splitting up the 8 hours to make it a little
Yeah.
less harsh for
Yeah.
people.
Amy, for educational purpose, can you talk about Dr. Jamie Ruskowski and what services that she provides?
Sure. So Dr. Osowski is our medical advisor. So she is responsible for our standing orders for our vaccinations. She's available for any consults that we need, for any questions that we have. I think that's about, and then she also helps on some health education programs on certain topics.
We bring her in when we need if there's a topic we're presenting where we feel like it really should be done by a medical doctor. So sometimes we have her for the tick-borne illness talk that we do, and sometimes we have her for
food allergy talk. Because when we're talking about prescribing medications and stuff like
Great to
that.
have her as a resource.
Mhm.
Totally. And so can I ask, just given all the news from last night and today in the paper about the new vaccine that are going to be supported is, I mean, she taking a look at that. I mean, obviously it's too soon, but
That'll all come down from the state level, and I am almost 100% positive the state had passed a new law in the spring session that addressed any potential changes that the ACIP could be doing, and that the Connecticut Department of Health plus some of the other area states were forming their own coalition to do their own vaccination recommendations. So I don't think we're going to be affected by the change at the federal level. And it seems like the change at the federal level is also not affecting the Vaccine for Children program or the coverage of insurance part of it. However, it does make more of a patchwork across the country now.
thank you.
Yep.
So do you have any more questions? Do you remember that show To Tell the Truth?
Deb, do you want to say anything about what you do and, or just
What I do.
what the most
Basically,
challenging?
I make sure the office runs smoothly. I know Maria from COVID.
I used to work for the health
Yeah.
department too.
Yeah,
during COVID.
she did.
Yeah. With the vaccine
And
programs.
I know Barb from Need and
Yeah, from dance.
from dance, our daughters dance together, and basically just coordinate everything, do what my
Deb
staff
keeps us
needs.
going.
I know.
She keeps us organized. She has all of our stuff on schedule. She knows where every file is and every piece of paper. And
Where we are.
I mean, she's the glue.
She kind of just keeps.
Keeps us going.
Flowing
I've
and,
seen that.
yeah.
That's great. Yeah, if you go to the door of Line Cottage, she's already opening it.
Yes.
Yeah.
Even though you have to press the button, and you're already there.
Yeah.
I'm gonna let you.
Come visit us at Vine.
Yeah.
We'd love to have you come.
Nice
And
environment.
visit.
Good, I always
Yeah.
worry about like,
You haven't been there.
dropping in on your
You-
busy
it's
day.
completely-
If we're,
like
sometimes we're not
completely
like, we're not all there, but Deb's always there. She's our greeter.
But I agree, everybody should pop by, not today, but
Yeah.
you know, because it is nice.
And we
to
have
see your
goodies,
environment.
I think so.
What are the goodies?
We do have some health promotional items as well.
Oh.
Yeah. All right, well, anybody have any other questions for them? Okay, thank you so much for coming.
And thank you for all your work, guys.
Appreciate it.
Thank you. We'll get back.
Yep. Thank you, guys. I love that you brought your drink.
Do you want to do your report?
Sure. So my report was super short this month. Sorry, it was right after the holidays and it was hard to get myself back into report writing. So we're still offering flu vaccines for children by appointment only. That is part of the child vaccine program. So those vaccines are free. The month of January is Radon Awareness Month. We will be doing a radon, I think a presentation, but I'm not 100% sure yet, but we do have free radon test kits that we will be giving out so people can test their home for radon. Radon is a colorless, odorless gas, comes up from the ground, especially through different ledge rocks. And it can be a potential cause of lung cancer. So it is
Says, where can you get those?
at Vine Cottage. We haven't started advertising it yet just because the holiday just ended. So we will be advertising that within the next week or so. You can see all of our numbers, and this month we have a skin cancer screening at Schoolhouse and QPR and Lunch and Learn at Schoolhouse. So that's about it.
Any comments on the flu season is obviously. very
Yeah,
intense.
so I looked at the surveillance information yesterday. We definitely we've definitely had a nice peak before Christmas, unfortunately, which is not typically where we peak. We typically peak 2 weeks after the new year-ish. So I'm curious to see if we end up having a second peak or if we just kind of peaked early this year. But the flu numbers are way up. COVID and RSV are not, so that's somewhat of a good thing, that you're just really seeing those flu numbers. But it is definitely up. And it's up early.
Is the strain something that the shot is like is addressing?
I haven't seen anything definitive come out on that yet.
The 90% of influenza right now is called the subclade K, which is a variant of the A influenza, and it was not covered in the vaccination. So and the most common vaccination that came out. So I think we're about nationally, about 7.5 million people have been infected, tested positive for it. 80,000 hospitalizations and something like 3,100 deaths. So if you look, New York State set a new record for influenza, and we're expecting the peak to ride out that New Canaan will be close behind. So it is pretty pervasive. You go to the hospitals, it is in the emergency departments, it is very pervasive.
Anecdotally, I'm seeing people in their prime knocked out 3-4 days in a way I haven't seen in years. Oh, it's.
And were they vaccinated too? Because doesn't the vaccination, even if it doesn't, prevent a strain, it does help you not get as sick, right?
Well, there's, I would just say the people that I know that I'm tracking are always fully vaccinated. They're elderly and they're at risk, but it still knocked them, to Peter's point, knocked them on their backside for about 2 weeks.
Wow.
But for us, it's really keeping them out of the hospital. You're starting to see more pneumonias develop because of it, and fluid in the lungs. So it is a real problem. And you're right. Anytime you get vaccinated, it does boost your immune system for a period of time. But just like any other virus, I mean, if it finds its way into the host, I mean, you are going to be symptomatic, and it's how your body, responds to it. And sometimes you get an over response to it, as like people that get shingles.
Yeah.
Right?
Yep.
Your body over responds to it on occasion and really can knock you out.
Really?
Yeah.
Oh, the shot. Yeah, the shot. I remember I struggled with it.
Yeah, it's exactly. Yeah, it's your body over responding.
Mhm.
It seemed like the last 2 years, the flu strain that was dominant was not covered by what was in the vaccine. Is this more of a trend that for some reason, we're getting different strains, or is this just normal?
Well, the last research I saw, only 20% of all of the strains are covered by a flu shot at any point in time.
Okay.
So if you look at H3N2, you've got influenza A, influenza B. I'm getting too technical, I realize, but out of A is a subclade K, and that is the one that's been identified as being 90%. So it's very, very difficult for anyone to develop a influenza vaccine that covers even 30 or 35% of what is out there. And so, I hate to be
Generally, there's a mitigating effect across all different kinds of flu. If you have the vaccine, it's not fully covered, but you're better off.
Well, there's no question. There's no question that, we'd had this argument, whether you're anti-vaxxers or pro-vaccines, that even people that had the COVID, whether you prove COVID or not, your symptoms were reduced oftentimes, right? At least from, the 1,000 patients that we take care of. But there are those patients where, it just hits you and you're flat out and pneumonia is developed, you're in the hospital. And we even have, we don't have, but there are people on ventilators right now that have caught the flu. So it is, not something to play with. But Amy is right. Usually we see the peak right after the holidays, Thanksgiving, Christmas, and everything. Now it's starting to push out Christmas in January because it usually is seasonal.
Yeah, our numbers for the week of December 20th were much higher than the previous years at the same time. So
the one thing,
it's been a double peak, which is never good.
The one thing I did see at page 7 of the handout, the material that came out was 2024. It'd be nice if that could be updated to 2025, page 7. So
Talking about the
full handout that was sent out with the minutes. If you look at all the attachment, there were like
okay.
19 attachments, and page 7 of it was 2024 and not 2025. But you can see in 2024, like influenza, there were only
I thought it was just her typo.
90 cases.
Wait, is this from last month? That is from 2024. That's 2024's data.
Yeah, I agree.
Okay.
I agree.
Oh, okay. I
I'm
thought it
just,
was a typo.
No, it was not a typo.
yeah, I agree,
It's
but
a full year behind.
my point was, thank you. My point is that's 2024 numbers. So if you think about 2025, how much it has gone up dramatically.
Right.
Influenza, it's significant. COVID was 243. Influenza was only 90 cases. So If you're a trending data person like I am, sorry,
We
And
love
then-
that about you, Russ.
sorry.
Also, a few months ago, I had
Apologize.
showed you the website for the Connecticut Department of Public Health, who does the respiratory surveillance. That's updated all the time. I went on there yesterday, and so it's a really good source of information too about the current trajectory as well as past years and see where we are.
Maybe you could send that out with the minutes.
Okay.
Yeah,
that would be
link.
great.
Yeah. That's good. Ends up.
And just one last thing is Connecticut did have its first measles case in December. And hopefully the only one. So we'll cross our fingers.
Okay.
Yeah, good luck.
Crossing my fingers.
I'm glad that the Connecticut has its own system in place for the vaccination.
We do.
Yeah,
We are
that's
one of, there was actually we'll just go off the top a little. There was actually an article in the newspaper over the weekend about vaccination rates of school-age children throughout the country. And obviously Connecticut and the New England area is exceptionally high, but you would be surprised at how many states are below the herd immunity threshold. States like Wisconsin that you wouldn't expect
Yeah.
per se. And then states like Arkansas are actually at the same level as Connecticut and Massachusetts. So it's a very interesting, I think it was a USA Today article, to show the differences in the vaccination rates among the country and how this is influencing the measles outbreak that's currently still going on.
Well, thank you. That's very interesting and
It's a
edifying.
lot.
Slightly disconcerting. I'm pretty sure I survived measles. You do it, but yeah. But also, Russ, thank you for being such a good resource. You know, we really appreciate knowing all of that information. And
I hate
and that,
being in the middle of it.
yeah, right, especially for that important population that needs that extra help. Okay, so I don't know if I'm sure everybody looked at Marcy's report. I spoke to her, she said there's really no change in anything from last year. The only main thing was adding the mental health training. So I don't know if anybody had any questions, we can always get back to her. It seems pretty straightforward in terms of trends, activities.
The only one question I had, and if you could just follow up with her, on her stats, when she went from Q1 to Q2, are those year-to-date stats?
Yeah, they are. I talked to her about that. I was like, is it doubled everywhere? She said, no, she's cumulative.
Cumulative.
Yeah, no, I had the same
All right,
question.
that makes.
Yeah, I was like, well, that's a big jump.
Exactly.
Double, yeah. So thank you for asking that. Yeah, I asked that. And the money that was given to the food pantry, you know, was just really extraordinary.
Yeah.
People are very generous. Okay, so now we're gonna turn it over to Peter Campbell, who's gonna give us an update on the assessment program at Silver.
Sure. This is going to be a high-level overview. It's a little uncomfortable doing it without Marcy. She's on the steering committee and does great work with them. And I definitely encourage anybody who is up for it to go to the town council meeting on the 21st, where Dr. Gerber is going to be
At the bottom of
presenting.
the agenda, yeah.
And that's going to be important. The headlines I wanted to share, I'm going to talk about major changes over the last year, talk about some of the metrics, and then some of the forward action. So some pretty significant changes. There was a name change of the program at the beginning of this year from the urgent assessment program to the assessment program. We'll see, does that have a real effect? It's not like it's a big brand change that everybody's going to know about, but it does signal a shift, and they're taking a careful look at what impact that might be having. We added Westport to the program in June, which is really significant. That's our third town.
Great.
And I'll talk more about the economics of that in a bit. And there was also a change in the team. Susanna Lewis, who we've seen here a bunch of times, was the founding head of it at Silver Hill, did a brilliant job, clinically very smart. She was a full athlete, and she moved on to back to her work in New York, which she had started with a long time ago. Liz Moore's taken her place. So those are some significant changes on the programmatic side. In terms of people who are going, what they are presenting with, it's still anxiety and depression, 74%, some mix of that. Suicidal ideation, 15%, and impulse control, 12%. And that tends to be kids who are having trouble regulating. And we know that's gone up a lot over the last couple of years. Those numbers are not mutually exclusive. A lot of times you're presenting with a number of things. But that shows you kind of what people are showing up with. I think really importantly, 7.5% of people who attend are taken inpatient. So, yeah, that's a real number and shows part of the significant impact that's taking place there. In terms of the demographics, still definitely being led by 0 to 18. That's still 56%. And that's been very consistent since the word go. And the other only significant change beyond that is the senior community, 60 and above, was 8%. Then they started, that's gone up to 11, 12%, which this commission was very focused on because we all felt that they were not represented as well, given the issues that are within that community. It's still 50% men and women, more or less. One probably interesting trend we're spending a lot of time thinking about is the New Canaan volumes, June through November of this year, which are the latest numbers we have. Last year it was 44, this year is 25. And that was pretty jolting when we first looked at it. But what we've learned is that the reason why those numbers are so different was last year you had 29 folks come in September and October. That's when we had the 2 suicides in town. And one thing they're starting to realize is not just sort of an ongoing program, but it's also a bit of a surge program too, that their volumes go way up when something like that happens. Thankfully, that hasn't happened. And so it was 29 last year. In those months, it's 12 this year. So the entire delta is from that. So I think they're studying that pretty carefully and thinking about it pretty deeply about the raison d'etre for the program, but it's got a bit of another use that we hadn't really thought about. And Dr. Gerber will go into a lot of detail on that, I think, on the 21st. The other thing they're very focused on is obviously the drive is to keep the volumes up, thinking the assumption being that there's a lot of this going on in town and there are a lot of people who could use this service, but a lot of them don't know about it, which is what we found in the survey. About 80-90% people were aware of the importance of behavioral health and mental health and had concerns about it. But only 50% of people in town knew what to do and knew where to go. And that number continues to lag. And the Silver Hill team is spending a lot of time thinking about that. But this is definitely a collective effort, foundation with us, and how do we continue to drive awareness of sort of what to do. I think one of the things they're wrestling with, my own observation, is what are the use cases that we're really targeting here. In the way the Silver Hill people say, if you think maybe we should call 911, maybe we shouldn't, you should call 911. That's the real urgent stuff, crisis, no doubt about it. That is not what the urgent assessment program is about, where EMS shows up, all those things. And there's also the lower grade folks who are suffering sort of a little bit. What the preliminary thinking is right now is that the emerging issues are what the program is really designed for. Something's changing within a family, something's starting to happen, people are starting to get worried. It's not at the crisis stage yet. That's really what it's designed for. But they're trying to refine that. And then by refining that, how do you communicate that so that people in the community understand that if you're seeing this, this is what the program is for. This is super complicated stuff because it's not black and white. It's very nuanced, and it's sort of an ongoing challenge, which I think we all own. And I definitely encourage anybody to go hear Dr. Gerber talk about this on the 21st. As a comment, I will say they continue to be incredibly open and collaborative and shifting and evolving based on input they get. They get a lot of input, and I find them to be pretty great town citizens. I mean, I know, Russ, you believe that as well. They really punch above their weight in terms of what they do for the town. Dr. Gerber's been a big part of that. On the funding side, the budget has been since inception, sort of around 250,000. The founding funders were the town, the Board of Education, and the Community Foundation for about 50 grand apiece, and then Silver Hill with their in-kind contributions made up the rest of the balance. The design was hopefully to add more towns, and that's in fact happened. For this year, Westport is contributing 40,000, and Weston is contributing 20,000. So by design, the town contributions have gone down from 50 to 40,000. I will say there's a couple other sources of funds. Still about 15% of the people who come through the program are not from these towns. They're from Greenwich, they're from Darien, and they're fully cash pay. So that's additional income that comes in. Obviously, New Canaan, we fund it. And if there's insurance, you know, the program will get the benefit of that, but there's nothing out of pocket for New Canaan residents. Insurance also makes up part of the gap. It's still a struggle though. Reimbursement is a mess and it's not very well designed. There's a lot of work going on that. Russ, you probably know more about that. I did worse. It's getting worse. You know, Russ sometimes says these things, like he said, it's alarming with a big smile. On his face.
What am I supposed to do, cry?
Yes. It's
So
okay to
I do
cry,
enough of
Russ.
that.
So, you know, for the budget, they're asking for 40 grand. I think all these issues will be discussed at town council and with the selectmen. It's a very dynamic program, dynamic situation, but I think they're working very hard and doing very good work on trying to lessen the dependence on the town. The Board of Ed are very happy funders. They've been one of the great referral sources for a long time. The school system is very focused on these issues and they're very bullish on the program and even the funding they're doing with the personnel on site now at the school system. And the foundation. And the foundation is obviously still a big contributor.
And our funding comes from the opioid settlement.
Right.
Which is actually designated to substance abuse. So.
Did you get an indication, Peter, since the school's Board of Ed is now funding, significant funding or a piece of it, how many of the referrals are coming through the school system as compared to outside?
27% has been programmed to date, but they're working on breaking that down. Is that evolving over time? And I think 3% comes from the private schools.
So 27% is coming from the school systems in terms of the 25 staff that you settled out there.
Yeah. The town still is a big referral source. Social media is, family and friends is still the biggest.
Primary, right.
There's a little disappointment around primary care. It's only 8%, and they'd like to have the program be more embedded with the primary care. And that's not a criticism. It's just.
And that's a marketing thing too. I think there's some.
An educational piece,
right,
maybe.
Exactly. That's that way.
Yeah.
And I think one other thing, and maybe you want to talk about it, I know it's brought up in research, is the potency of marijuana right now and the increases of psychosis that is occurring.
Yeah. I think psychosis showed up as 3%, just in general of the presenting.
So most of those individuals then ended up in the, and through our EMS and ended up in the emergency department then?
That's my understanding, Don. You would know better.
Don, do you have anything? Yeah.
I don't really know in terms of differentiating between psychosis versus just mental health.
Right.
I mean, what I was thinking about is if there's an initial emergency, it is call 911 because the assessment program will get to you within 48 hours. And the assessment program is really more, the value of it is that you get the diagnosis, you get the time with the psychiatrist and you get the social worker, and you also get their huge referral systems so that you can look at. And so when you're trying to then find a clinician who might be right for that person, they've already done the vetting and they can already have that conversation with the clinician that, this is what our evaluation of it is. Whereas if you're cold calling as a parent trying to find whether for, for a family member or a friend, you just don't have that. And that's, at least in terms of the one or two people I know who've taken advantage of the program, that was the real value, because they had been trying to find someone in a critical situation and weren't able to. But also, I mean, some of the situations that come up, and we've had it with EMT, is that you show up at a house as a teenager and when you've been called because of suicidal ideation and the parent doesn't even know. It's been reported because of a friend and through texting. And so in that situation, it's clearly 911. And at that point, the parent is scrambling around to figure out, where do I go next steps? Because I wasn't even aware that there was a problem.
Yeah, and the thesis, the awareness issue is that if it's not on your mind, you don't sort of know where to go. The second it's on your mind, you learn everything. Like you're just not gonna, in a placid moment, you're not gonna be putting that number on your by the telephone, and that's.
And I think sometimes because of whether it's New Canaan Moms, whether because it's just, networks, people, at least initially, if they're aware of a problem and it's not an absolute emergency, it's building, because a lot of times these things are slow and you identify it and then you figure out where it's going, that they're initially trying to tap into a network. Do you know someone? Have you had good success with someone? Or I know someone else's kid who's had similar problems. And they're trying to work through that first. And then some people obviously don't have that as a reason.
So that goes back to a question I had on your survey, and I remember the survey coming out. I would assume that most people that respond to that are adults, not kids under 18.
Yeah.
But yet you have such a huge percentage of kids under 18 going into this program. How do you get the word out to them? Because a lot of time they want to remain independent from their parents if they're dealing with something. Are there any type of surveys within the school?
The schools, there's still ongoing work to do a below 18 survey.
Yeah.
It's complicated.
I can imagine.
There's HIPAA kind of stuff. And then there's the school systems.
Mhm.
Now they've got climate surveys and things like that, but to your point, there's nothing on the nose out there right now, but there's ongoing discussions. The foundation is driving it. There are a lot of constituencies.
I'm just wondering if within the churches, if you get the word out, different youth groups, just getting the word out about this program that way.
Yeah. Well, the thing is that that's where most of the volume is coming from.
Right.
Kids are, as you all know, kids are pretty open talking about this anymore than adults generally amongst themselves and things like that. But we don't have that window from a data perspective into the kid. Russ has been on this point for a long time, and he's absolutely right. And we've recommended as a commission that something needs to be done to fill out our knowledge and awareness. But you're absolutely right about the program. I mean, New Canaan Cares is amazing on this stuff, especially addiction and stuff like that. And they've got
Prevention, yeah.
We also have the school nurses who
I was wondering.
they see most of these kids in the office. They're the frequent flyers. So as long as the nurses are educated about the resources in town and they can tell parents and students about it.
And are they educated on this program though? So
I believe they are.
the school systems are very plugged into the program.
They are, okay.
That I know.
okay.
Mhm.
And they're big funders and
Supporters. Yeah.
supporters, yeah.
Well, I'm wondering if maybe after Dr. Gerber presents to the town council, it might make sense for him to come to talk to us, like maybe at our next meeting in February.
Yeah.
If he's available, I think that would be good because we'll learn a lot at the town council meeting and then we can do the follow-up discussion of what, if anything, we can do as a commission.
Would it also be appropriate at some point in time, maybe a couple months down the road, as we were talking about the counselors in the school system, maybe have whoever's the head of the counselor to come and talk about what they're seeing or if there are any issues, because we have so many great nonprofits here that are involved, community foundations and everyone else. Sometimes you got to go to the root and the people that are on the front lines and what they're seeing, and which is maybe a little bit different than taking a survey and sending a survey out to people.
And I'll sort of jump ahead to one thing I was going to touch on later is that the Community Foundation just did a series of grants through the Behavioral Health Committee, which was a follow-up to the community-wide health survey. And then it was also looking at systemic changes. And they made a grant to Kids in Crisis because they're launching a Kids in Crisis text helpline for teenagers and kids, because they realized that they weren't taking advantage of the phone lines. And so they had to develop a program which was to meet kids where they are, which is the texting. And so the Community Foundation grant is just a small grant in terms of the total program. It was something that they were otherwise realized that they needed to do and wanted to do. And so they've gotten grants from a lot of the surrounding towns as well. But that's an example of the initiatives that different organizations are trying to implement to reach kids where they are in their preferred mode of communication.
And let's not forget, taking cell phones out of the classroom
Right.
has had a dramatic input in terms of improving grades and improving focus and
Social
and
connectivity.
social connectivity and breaking that. That's had a tremendous impact, I think, on the school system in a positive way.
Okay, so we need to move on because we still have two more things, but I do think it'll be great if we have Dr. Gerber and his team come next month or the month after, whenever works for them. So I just want to just briefly talk about agency liaison assignment. We talked earlier about giving the agencies that we fund, assigning somebody, and we've done this, ongoing, but one of our representatives of the commission to go and get to know that organization. And so we've got impact our discussions about funding. So I'm just going to review it. Silver Hill obviously is Peter Campbell. DVCC, Alyssa is going to continue doing that. But I was just having a conversation with Russ, and he's agreed to be a partner with her on that. They participate in something called the New Canaan Abuse Prevention Partnership, which is a monthly Zoom call, which Dee Dee Bartlett, who started DVCC, forms. And I think Russ, obviously with all of his knowledge of what's going on in the town, can have a real impact on that. So he's agreed to do that. John is going to continue with Meals on Wheels, and Jen is doing Get About. Maria, I called Maria and I said, do you ever get a chance to go to any of those programs? Do you think maybe you could do New Canaan Care? She's like, I go to every program. So that was a no-brainer, right? And Tracy, that leaves you and me unassigned, but we can talk about, maybe anything you might want to piggyback on. But just in terms of the role of liaison, I think the main thing is we just look at the organizations that we fund and just go and meet with them. Maybe you meet with somebody in management or leadership, and then also maybe just participate hands-on, like spend an afternoon on the Get About, which is just very educational to see, how important what those services are that are provided. And then, as time goes on, find out if there's any issues they have and if there's a way that we could maybe help support that. And then because the funding process starts really in October, I think it would be good is if the liaisons could come and report in either June or September, and then that would help inform our discussions of the funding for the next year.
Yeah, and as funders, we have an additional opportunity to make suggestions. And even here, we see a lot of things that the individual organizations might not see. So I definitely encourage people, liaisons, to be active with suggestions, not like, directive.
Yes, not telling them what to do, but more finding out if there are ways that we can. So,
or offer insights that we pick up
Exactly.
here, because most of the leaders, these are complex issues that we're all dealing with, and they're trying to figure out the truth and how to get at them, and we can play a role. I mean, it's one of the things that we can do as a group, take our collective inputs that we get and then distribute it back out to folks who don't get to see all the organizations that we get to see.
and it's a really excellent point. That is a way that we can be valuable as liaisons. Does anybody have any questions about that? Okay, so then we're just going to move on to our new business, which is John Knight's agreed, and Jen's participating to talk about a new initiative that's
Do
a
you want
town
to do the
initiative.
grants first and then do that? Or you want to do it? I was just going to mention.
Oh, you want to do the grants first? Sorry, I was
Yeah.
like, are we making grants? No.
No. sorry.
Everybody,
I mean,
the reason I gave you a new
This
agenda.
was more.
Yeah.
So, because we had the community health.
You guys
thing,
wanna
sorry,
look
I
at
just
the-
wanted, this was more to just make sure people were aware of this, because there are a couple of places where it touches on things that we both as a commission then and also our subcommittee that was focused on senior issues, where some of these things are relevant. But so what they did is at the Community Foundation, there's a separate behavioral health fund. And so they have money which they're able to use and give out outside of the normal grant process. And so they had an RFP back in September asking for people focusing on either system-wide changes, which is like the Kids in Crisis and the text Health Fund, and then also things which specifically would support work in the behavioral health space on issues identified in the Community Health and Wellbeing Survey. And so they ended up making 9 grants in total for about $108,000. 3 of them were systems level change grants, and then 6 of them were sort of supporting community needs around behavioral health. And you'll see a number of them actually are support groups, whether it's for parents in a sandwich generation, which are supporting a senior as well as children. It could be just parents who need stuff, kids who need stuff, disabled adults in the community. But another one that is relevant is Laurel House, is they're a big network for resources in Fairfield County. And
Abuse, right?
well, mental health,
Mental health
everything,
too,
but
okay,
they're
yeah.
doing a deep dive into all of the resources in Lower Fairfield County around behavioral health and looking to be sort of a focal point and a clearinghouse with people who will be able to point people in the right direction based on needs. So they'll have sort of intake and then giving people ideas. So anyway, I wanted to just make sure people were aware that this was going on sort of next to us because it does impact things in the
And this
community.
is kind of an output from the survey, right? These were
Yeah.
some of the biggest issues.
Yeah, and both Peter and I are on the Behavioral Health Committee. And so if anyone is interested in any of these and would like more information about what is actually involved with this, because this is just a very short synopsis that we're happy to get any of you information about.
And given the questions, thank you. Thank you for calling attention to that. I appreciate it.
And then the next point we want to talk about is that, as everyone knows, Jim Lisher was very passionate about seniors, telehealth, New Canaan, all of these wonderful things. One of the ideas that he was very passionate about was this idea of an optimal living community and sort of a recognition through AARP that you're this type of community. And so it's something that he had talked about with us in our subcommittee. He talked about it with other people over the years. He also had talked about it with Kim Norton in the fall. She's our liaison with town council when he was talking about some of the survey results from our focus groups with seniors during the summer. And she was very interested and supportive of the idea of trying to move forward with that. And so she had reached out to Barb and myself and Alyssa as members of the subcommittee. And separately, Jen had been talking to Barb about, looking into this and pursuing it, because it was something that Jen had been involved with Jim and with Greg Riley in terms of applying for a grant several years ago. But because we didn't have that recognition, we weren't eligible for the grant that Jim was interested in pursuing.
I'm just going to correct you on that. I think we were still eligible.
Are you still eligible?
It was
Okay.
just that it didn't, we were not successful.
Okay.
This is a different avenue to pursue.
Okay. But so Kim had reached out to us and she had done some work with AARP looking into what was involved and all the rest of it. And so she had reached out to us and Jen was separately thinking about this. And so she and I are going to take on the project of doing a deeper dive, but we think that it's something we just need to get the information together. We likely need to involve some of the other groups in town to get information about New Canaan, about the livable community, but we're happy to take it on as a project and we'll coordinate with Kim or others on the town council as need be, because we'll eventually need a town official to be a sponsor of the application.
I think it might be important to thank you so much for taking that on, because I know Jen came up to me just at the same time as Kim. So it's nice to know that everybody's thinking the same way and thanking Jim for, identifying that as an important issue. But it's also maybe important to identify that it's not part of your senior committee, right?
It's something that Jim had discussed with us in terms of the issues that came out of our focus group. That was not something that anyone had identified as critical for them or important to them. So it's actually easier to move it outside of that type of consideration and have a separate track. To give an update where we are with the subcommittee, we had tabled making any recommendations back in the fall for several reasons. One was we didn't yet have an internal consensus on our final recommendations, but also at the time, we knew that the Community Foundation was going through this RFP process around the behavioral health issues. And we also, Peter had been working with his subcommittee on looking at, what our priorities should be as the Health and Human Services Commission. And so in the interim, obviously, Jim passed away, Tom has retired from the board. So our plan is that Alyssa, Barb, and myself are going to get together. We're going to go back through where we were, look at the recommendations, look at what the Community Foundation has done, and then we're going to come back with a series of recommendations to sort of close that out for consideration by the committee. But we'll separate that. And in the meantime, this optimal living community application with AARP and hopeful recognition, we can start on that independent of that.
And I think, oh, sorry, go ahead.
Yeah, John, quickly, are there criteria for optimal livable community? I mean, is there,
Jen,
is
you wanna
there,
speak to that?
yeah, is there something you can send out and just email us of what it,
I'll send you, actually,
definition?
it's very easy. There's a link to kind of their intro page.
okay,
But one of the reasons why we think this should be a pretty smooth process is that we have worked hard as a community to have many of the things that they identify. And even the steps that they talk about in terms of, getting the town on board and identifying goals, doing a townwide survey. We've already done a lot of those things, outside of this. So this would be more a little bit of giving it a label and, saying we are recognized as a livable community, even though on our own as a town over the, past years, we've already kind of done a lot of the steps.
And
so
even
it's
if
really
that
just
makes sense.
bringing all the pieces together in a
Yeah.
cohesive manner.
Yeah.
Staying put, Wheels on Wheels.
Yeah.
About Lapham
And-
Center.
But do we
And
know what
again,
the
like the
scoring
first thing
is?
they say is
Yeah.
to get people from your town leadership on board and do a townwide survey. And,
Based on Kim's discussions or email exchanges with AARP, they've said they've never turned anyone down.
Oh,
so this is really more,
Okay.
it's more of a symbolic designation.
got it.
So one of our
Yeah.
thoughts is to have an initial
So
conversation.
let's not be first.
With the same.
Yeah,
Yeah,
exactly.
exactly. With the same people that she's, approached to just sort of confirm what it is
Yeah.
that we need to pull
Got it.
together and,
Beautiful.
and maybe we could work with them so we don't overwork it.
Beautiful.
Mhm.
We sort of meet them where they
And I'm-
need to get.
We're kind of hoping we go back and look at what Greg Riley and Jim had come up with for the challenge grant that they applied for. And hopefully a lot of the information will be, sort of the
Kind of
background
boilerplate, yeah.
information that they ask about our community and how things work in our community. So, and then we can go from there. But it does connect us again with AARP, which can in the future be a huge resource. And it would be great. I know what Jim was really passionate about was getting some of these challenge grants to then be able to go out and do new things or expand on things that we're working. So anything that sort of leads us in that direction would really be,
Yeah, it'd be wonderful.
I think, more a nod to him.
Are any
Yes.
other towns locally already designated?
Yes, there are. And there are also some states designated, but I don't think Connecticut is. I will
Let's not
send
take that
out.
on.
No, thank you. I'll send out this link and it actually has a thing where you can read, everything. And it is across the country and there are a bunch of places.
Thank you both for taking that on. and
Absolutely. Thank you,
Hopefully you can get
Oh.
some support from the town too, if you need it, in terms of maybe the chamber,
Yeah.
the realtors, they can all help maybe, because it will be a real huge benefit for
Sure.
everybody
Yeah.
who's marketing our town. right?
Yep.
Thanks to Kim for supporting it.
Yes, yes. Thank you,
I
Kim.
have a question.
Sure.
This has actually been going on for quite some time. I actually was the one that introduced.
I was just gonna say, Penny probably knows all
There you
about
go.
this. Yeah.
Do this, and, but it was through the State Commission on Aging, which
Okay.
as you now know is seniors, women, children, equity and opportunity, because they merged,
Mhm. I didn't know.
all of the social service
Really?
commissions together, but yet operate as 6 separate focus areas. So I don't know whether or not this has gone past the state and has been assumed by AARP,
Hmm.
or is it still being a key focus on either the Department of Education or social services, or what? I mean, what's the path of this, progressing?
That'd be good to know.
Because it's gonna make a difference on qualifications for state funding or qualifications for foundations and, you know, that sort of stuff. So it's really, you're gonna have to dig deeply into Jim's papers and research to really put in the appropriate bucket, shall I say.
That's, yeah, that's a good
Can
point.
I make a comment? I'm sorry, I'm on Zoom. Hi, everyone. It's Kim Norton. Yeah, I think this is a different process, Penny. ARP is a different entity, and I don't know how they're connected, but my impression after talking to ARP was that no one's been rejected. It makes puts us kind of in a network of senior optimal living communities across the country, of which I think there's about 1,800. So it's a voluntary designation. It also gets us to start thinking about things like, for instance, Waveney Park or Irwin Park. Are there things that we can do, like a potential grant would be to make that senior friendly in some way? But it's got 8 different avenues of looking at optimal senior living communities. So it's really more of an aspirational thing, but it's not that difficult to apply for. And like Jen said, we've already done the work. You guys had your senior group, you have the survey. So it's much less bureaucratic than that process that that Penny just described.
Thank you. Thank you for sharing that, Kim. It sounds like it could be a real win-win, you know, pretty easily. So that's wonderful. And I'm glad that we're going to move forward with it because it meant a lot to Jim.
Well, you'll find that AARP is an entity within itself and
Right.
has a national identification through the AARP organization. But it is very different than how it's recognized in state governments
Okay.
and through the national organizations and the various aging ones. So all good work, but sometimes the various organizations strip on one another.
Yeah, no, that's our tax dollars at work. No, that's really helpful, yeah, to see that it's a broader thing than just AARP. No, thank you for giving that to us. I don't know if everybody knows that Penny's been the expert on seniors for, I don't know, 40 years.
Before she was a
What's
senior.
been a number?
Before she was, I remember your first survey, it was like in 1985 or something.
Wow.
I remember that. So anyway, thank you for being here and thank you for sharing that. Does anybody have anything else?
I just think one thing I've asked my fellow commissioners to keep track of is just insurance coverages, accountable care, Medicare Advantage, people coming out of United. United's cutting a million people nationally out of their network, Medicare Advantage people. So the number of uninsured is going to peak. And it is going to put a lot of pressure, my feeling, on our services that we currently provide in this town.
Right.
And I just want a red flag to go up. We talked about SNAP. We've talked about the Affordable Care Act and the governor's bill to add 70 million. Well, 70 million is not going to get us very far. So I just want to make us sensitive to that because it will have an impact on human services and the requests coming through on the nonprofits in town, the emergency departments, people. So it's going to resonate.
No, that's right. And yeah, I think Marcy's very aware of that, but it's really good to see that and to understand that it, you know, that SNAP's, you know, presentation, I saw 36,000 people losing that benefit over the next couple of years.
Well,
in our
the state of Connecticut alone is going to lose over 300,000 people are going to lose their insurance.
Right.
And the affordability and the subsidy is going to go away. So even though, you know, people are throwing around, it'll go up 300%. Well, going from $100 a month to $400 a month for someone that is on marginal income or minimum wage is a lot of money and kicks them out into the uninsured and non-Medicaid grouping. So I just think that we need to be sensitive to that because that tsunami is coming in terms of service needs.
Right.
But it seems to me it also makes all the more important all the preventative care services and the
100%.
things like Alan's doing with trying to identify issues earlier rather than waiting till people need to go to the hospital or are unwell.
100%.
Thank you. Okay. All right. Well, anything else?
Anybody else? Okay.
Motion to adjourn.
Thank you. All in favor? Oh, wait, sorry.
Oh,
Did
I'm
did
sorry.
you vote on the minutes?
Oh, we did sort of super quickly.
We did.
So we sort of flew through it and I just put in Russ as making the
Yeah, I made the
motion
motion.
and John
and John seconded
seconding
it.
for both
Okay,
the new
I wasn't
agenda
sure. I
and
just
the
wanted to make
minutes
sure you didn't
and
skip it.
both as
For you.
unanimous.
Good for you.
I was like,
Sorry.
Yeah.
You keep
I was just trying to speed things
No,
up.
I
keep
know
Barb
it's very
honest.
quick.
Keep
I
Barb
know,
honest.
I know.
Please do.
But is everyone okay with that remembering
also
of how
do
it
them again.
happened?
Yes.
All right. We'll have to include the new agenda
Yes.
when we send out.
I make a motion, we're all in favor.
Oh, thank you for that
I
reminder.
second your memory is
All in
that.
favor?
And all in favor of all in favor.
Exactly.
Okay. So stop recording.
Motion to adjourn.
All right.